At some point, a person with Alzheimer's disease or a related dementia may need to move into a residential care facility. Families frequently ask, when will I know when to make this decision? It's important to be aware that this is an individual decision that families must consider based on various factors. For example, if the person with a cognitive impairment is living alone, as their dementia progresses, they will not be safe to be alone and may need to move into a different living situation. The health and availability of a spouse or family caregivers also makes a big difference. If family members are working during the day and the person's alone, they may need a different setting. Additionally, many spouses that are caregivers can be frail and have their own medical illnesses that can affect their ability to care for the person as their dementia progresses. And also the amount of care that is needed can make a difference. I've had families say to me, well, when my person becomes incontinent and loses control of bowel or bladder, that's when I may think of moving them to a residential setting. So be aware that it's a very individual decision. There are several types of residential care settings that can be considered. Assisted living centers are one option. Some of the centers have memory care only, but others have progressive levels of care that can range from individual apartments to memory care units. Assisted living homes are private residences that can care for up to 10 people. And some skilled nursing facilities also have dementia care units. So when considering a residential care facility, I always stress that it's very important to be proactive and plan before this type of setting is needed. It's easier to plan at your leisure and visit when you have time rather than to feel pressured or when a need is imminent. So you want to visit several facilities so you can compare the care at the different settings. Make return visits. Go back unannounced. You want to ask questions. You can use the Banner Alzheimer's Institute form, which is called Questions to Ask When Visiting an Assisted Living Memory Unit, that has a number of questions that can be helpful. You want to observe the other residents. Do they look happy, content? Are they busy? Are they being occupied? Do they look well cared for? Be cautious about including the person with dementia in this planning process, as they can become anxious, resistive, or fearful. And again, as their judgment and insight is impaired, it's hard for them to make these major decisions. Sometimes a respite stay in a facility can help you to test it to see if the person would fit and to give you an idea of the care. And finally, be aware of the payment sources, especially if all-tax is needed. It's important to find facilities that have an all-tax contract if this would be the case.